If you happen to be suffering from gout, now what is gout? You will know the signs that a flare up is on the way. You can't really stop an attack once it has started, but the good news is that you can make it a little less painful at home. So, what are the warning signs of a gout flare up that is about to happen? Some people with gout, which many know as gouty arthritis, say an attack begins with a burning, an itching, or a tingling feeling in the joint, maybe an hour or two before the flare up starts. The joint may feel a little stiff or a bit sore. Not long thereafter, the telltale signs of a gout begin. Now, if you get repeated attacks, you will learn to recognize your body signals that one is about to begin. Sometimes people with gout have no early signs that a flare is about to start, which is unusual and sad. They may just wake up in the middle of the night with a very painful joint, which is terrible. When the flare starts, most people have redness, swelling, and severe pain, usually in one joint. The most common place for gout is the base of the big toe, but it can happen in other joints such as the elbow, the knee, the wrist, the ankle, and the instep. So, what can you do to care for a gout flare up when you are at home or take care of it at home? Now, if your doctor has diagnosed you with gout and given you medicine for a flare up, naturally take the medication as directed when you know you're having an attack. Now, in most cases, that will probably be as soon as the first signs begin. Your doctor may prescribe some of these non-steroidal anti-inflammatory drugs called NSAIDs, or suggest you take over-the-counter like ibuprofen. Depending on your medical history, your doctor may prescribe steroids or other medicines to reduce the inflammation. In some cases, you may be taking medicine like colchicine to prevent gout flare-ups. Your doctor may also have suggested other medication. If you can't take certain medications or it is not effective, your doctor may offer you an alternative. It should be used with caution, for example, Uloric. However, because it has been linked to increased risk of deaths from heart disease and from other causes, so you need to be extra careful. So, what should you do? Just because you have a flare up doesn't mean these medicines are not working. In the first few months that you take them, you may have an attack as your body adjusts to the drug, because the body does need some time to sometimes acclimatize themselves. Your doctor may likely happen to give you something to take if it happens too. That's the job of the doctor, to make sure that they take care of the preventive actions. So if you've been taking preventive gout medicine for a long time and you're having flares for the first time in a while, call the doctor. They may talk to you about changing your dosage or your medicine, because sometimes after a while the body gets used to certain medication and it is less effective. Now, how can you take relief from the pain without medication? That is a question which most of us would want to know. Use cold. If your pain isn't bad, try a cold pack or a compress on the joint to lower the inflammation, because cold normally will actually reduce inflammation and soothe the ache. Wrap an ice in a thin towel and apply it to the joint for up to about 20 minutes several times a day, or as often as you feel that you need it. Do not apply ice to your hands or feet if you have nerve problems from diabetes or other causes. Now, it's also a good idea to rest until the pain eases out. If you have pain in the foot, don't keep walking and walking, or you make it worse. You probably won't want to move it much anyway. So you can raise the joint on a pillow or other soft object so that you can actually rest it and give it a bit of elevation. Now, drink plenty of water. Why do you need water? When your body doesn't have enough water, the uric acid levels rise even higher. So stay hydrated, drink water, not tea, not coffee, just plain water. Stay hydrated to help keep those levels normal. Watch what you eat and drink, basically watch your diet. Foods that are high in substances such as purines, such as seafood, organ meats like liver and fatty foods can raise the uric acid in your blood even more. So can the fructose sweetened drinks and alcohol, especially beer, which many will love. So when do you get help for a gout flare? It's always a good idea to let your doctor know that you are having a flare. Sometimes you may need to follow up to make sure your treatment plan is working or if your symptoms don't improve. Now, call your doctor if this is your first flare up. There are several other conditions such as joint infection that have some of the same symptoms as gout attacks. You have a high fever and chills. Gout attack symptoms may include a mild fever, but a high temperature may be a sign of an infection. So don't always lump everything into as just a gout. It may be something else which may be a bit more high risk. Now, if your symptoms don't get any better for 48 hours or don't end after about a week, don't start to feel somewhat better after a few days, call your doctor. They may suggest a different medication or a different treatment. Most gout attacks will go away by themselves in several weeks, even without treatment. So you know now what gout is, and you know what you can do to help yourself at home to prevent it. So do take care of yourself.